Okay, seven. Oh,
We're
it's
live.
Welcome back to the Committee on General and Housing, everybody. And thank you for coming. This is the 22nd of January, 2026. And we are continuing our hearings, so focusing on the kingdom, the North, which really is representative of many of the issues facing rural Vermont in general. And our witness this morning, our next witness is Patrick Shattuck, who's Executive Director of Rural Edge. Patrick, why don't you identify yourself for the record and talk to us?
Great. Thank you for having me here this morning. I'm Patrick Shattuck. I'm the Executive Director of Rural Edge. We're the housing organization serving the Northeast Kingdom of Vermont. We've been in existence for about 40 years, and I do have a PowerPoint presentation to hopefully share with you. So our mission is to strengthen Northeast Kingdom communities one home at a time. And that is really how we focus on work. We rely on lots of resources and lots of energy to do that. But ultimately, it is keeping things about small Northeast Kingdom scale, impacting our neighbors and the communities we serve. For our organizational history, as I said, we've been around about 40 years. We began in 1986, and we focus on permanently affordable housing. So our first development was Gilman Senior Housing, which was the original manager's house for the Gilman Mill. Because our housing is permanently affordable, we still operate that. It's fully occupied, has services there, and has a long waiting list. I believe at last check, there were 51 folks on the waiting list for 10 elderly units in Gilman. With that, our portfolio has grown. We're a nonprofit, we're community-based. We focus on affordability. And we look to strengthen homes and communities in and around the Northeast Kingdom. In 1998, we became part of the National NeighborWorks Network, which brought with it a home ownership center. So lots of focus on training folks to be homeowners, financial counseling, financial literacy, post-purchase counseling, foreclosure prevention, which unfortunately is on the uprise again. And we have a board that includes public members, private government sectors, and resident representation.
How many units do you have more or less under?
We had just about 1,000 units in just about every corner of the kingdom. We've currently got, I believe, 22 projects in our pipeline. In this photo, the one in the upper left is in West Burke. So the building, the teal building in that photo is 9 units of senior housing, and up on the hill above, we've got 14 units of family housing right in the village, looking at the rural scale. But when we talk about challenges of developing in a rural environment, we have 23 units. It has 4 separate septic systems. It has a community water system that we have to maintain. It has about 1/3 of a mile of road that we own. And those 23 units are not in one nice double-loaded corridor. They are in 5 total buildings. So when you think about the yard upkeep, the snow removal, all of the different systems to maintain, the challenges of working in a rural environment is so much more difficult and so much more expensive, but this is what fits in the community. And it's a great project. In the lower left was Derby Line Gardens, which is another elderly project, 12 units right on the Derby Line green. We bring a lot to our service area, about 1,000 units of perpetually affordable housing, long pipeline, partnerships. We're willing to work with groups, provide feedback, suggestions. We administer the VHIP program. So we've put about 200 units online since 2021 through the VHIP program. We've saw in the last year about $4 million go out of Rural Edge to private landlords, and we oversee those projects. This has been really impactful in bringing units to very rural areas. So we would never develop units in Bloomfield, but we have 5 units in Bloomfield. And just about every small community in Essex County, we've been able to add units through this program. So it's a really effective complement to our program in providing much needed rental assistance. One thing, unlike the other housing organizations which administer the VHIP program, which provides grants up to $50,000 to private landlords to bring units back online, there's a goal of housing folks moving from homelessness. Well, that's a great goal, but folks moving from homelessness probably can't afford HUD's fair market rent of $855 a month for a 1-bedroom or close to $1,000 for a 2-bedroom. So if we're truly going to meet the goals of the program, we applied and received a grant of HOP funding. So Rural Edge actually administers our own rental assistance program for those landlords. So if the goal is to house folks moving from homelessness, we've got rental assistance, and we also have a separate contract funded through that with NECA to provide intense supportive services for up to 18 months. So the goal is to help people become permanently housed and maintain that and make VHIP work. Now, one of the problems, VHIP only has a 5 or 10 year, depending upon the option, affordability. And we know that there are lots of landlords who are looking to transition those units at the end of that affordability period to short-term rentals or to really increase the rents. And so as you look at programs and changes that would be impactful if we want to house Vermonters, it's ensuring that there's permanent affordability with the VHIP program. We have construction projects that bring millions of dollars to our communities. We contribute over $900,000 annually to local and school taxes. We provide guidance if people want it. And we really serve the most vulnerable Northeast Kingdom residents. 43% of the households we serve have moved from homelessness at some point. That is the highest of any of the housing organizations in the state, in part because in the Northeast Kingdom, we don't have an organization that exclusively serves folks moving from homelessness. So we are the housing arm working very closely with our partners at NECA and Northeast Kingdom Human Services to provide housing. Now, we have to report that. And I will say, I question whether someone who's been successfully housed for 6 years should still fall in that figure, but it's someone who's moved in from homelessness. So we do have those cases where people have had housing and they've got stability and they're able to see jobs and their kids graduate from high school and go on to college. So it's really a testament. 70% of our household residents have incomes less than $20,000 annually. So we are serving very, very low income residents. Now, I think it's important to put the pieces together. You'll have lots of programs, lots of asks in front of you. I use this as a success story. This is a couple who actually spoke at the opening of our emergency shelter, the shelter at Moose River, which opened in late 2023. Until that time, we did not have any permanent shelter in the Northeast Kingdom. This is Samantha Carr and Tim Kidder. Both had histories of addiction and ended up in the shelter. In fact, Samantha had been our tenant at one point prior to this. And they ended up in the shelter and they were there for just under 6 months. And there they got the necessary support and services that they needed to really transform their lives. And they spoke passionately and shared this, it's been in our annual report, about the impact that they had. But when we talk about putting the pieces together, the shelter was paid for with housing from the Vermont Housing and Conservation Board. It's a permanent resource for the community. But from that time, they moved into a VHIP unit using our VHIP rental assistance program. So the landlord has security. They know that when they moved in, the rental assistance was paying their entire rent. Our program has 18 months that they can stay with it. Samantha has had 4 different jobs, each time getting more hours and taking on increasing roles. There was another person who moved into another VHIP unit in the building, who moved in from the shelter, and they had severe health issues and were no longer able to care for themselves. So they actually moved to a different VHIP unit with 2 bedrooms so they could take care of that gentleman. So Timothy serves as a caregiver. She works, and they just had their last rental assistance, and they will transition to the point where they are positioned very well. Their rental assistance amount has diminished over the 18 months, and they are able to take on the full rent and have helped others, are sharing that because we have Vermont Housing and Conservation Board. We have funding, we have VHIP funding, we have rental assistance funding, and it's so imperative. And I think this goes back, I highlight this couple because, our mission is one household at a time, and they are one household at a time. But we do that times thousands because Rural Edge in our just under 1,000 units house about 3% of the residents of the Northeast Kingdom. So I was asked to talk about some of the challenges we see. We know that more housing of all types are needed, but there are many challenges to bringing new units online. And these are just some of the issues: cost, the exposure and risk, that's time, the amount of money you have to invest when you don't know you're going to be able to get any end product. Rural infrastructure, lack of rental subsidy, construction trades, and then I've included some that you may not hear about as much: elevators, and then the realities of operating. So on the left are some of our projects. The upper left is on Route 105 in Newport Center. When I was before you last year, you saw a video of a building under being demolished. This is what has taken its place and will be occupied beginning March 1st. That's 8 new units of family housing. It includes 3-bedroom townhouses. It's 3 doors from the school, adjacent to a playground right at the center of town. And the blight it replaced is remarkable. The town is ecstatic to have it. Across the street, there's another 6-unit building on a brownfield site that we had to remediate that's adjacent to a wetland. So, you never have an easy site that we work with. In the middle is Packard Court, which is the hole on Main Street in St. Johnsbury, which has been vacant since a fire 16 years ago. We will be breaking ground on that in May. 27 new units of elderly housing. And in the bottom left is the addition at the convent at Sacred Heart, which is 4 floors to maximize that building. That building will be complete. Of course, that whole complex had been empty for more than a decade. 26 units will be placed in service April 1st. And then we'll be starting later this year with 32 units in the school. So really creating a new community in Newport, walking distance to downtown, public water and sewer. But just to elaborate on some of those things, cost. So we've had 4 large developments, net new units. We know that has been the directive that, based on our original designs, third-party cost estimates, updated cost estimates, and schematic design were considered fully funded, only to go out to bid in a 12 to 24-month window after that to find that construction costs had increased between 40 to 100%. That is a really big challenge. Higher increases we're seeing at smaller projects or projects that had scattered sites with smaller buildings. So again, speaking to the challenge of rural construction and the rural scale, it's a higher cost for general conditions, for contractors to mobilize. Lots of the requirements, because of the size of a total contract to get larger developments, require more bonding. So we aren't able to get necessarily local contractors, and there's just a shortage of subs. So, we have worked through that. Lots of design modifications. How can we fit in another unit? How can we value engineer? How can we seek additional resources? But each one of those decisions, creates more time and adds cost when the housing is desperately needed. Naylor and Brain recently did a divisional cost increase analysis of large-scale projects, 24 units, that they completed between 2020 and 2024. And they saw, based on AIA line items, increases of between 16 and 578% on line items. But the average per unit cost increase was 53%. This impacts us, whether nonprofits, it impacts the private sector. When we talk about needing new units, this is the reality. I did not think, I just painted my house, a house in Guildhall, an old house. It was $60,000 to paint an old farmhouse. And we know that those are the conditions. That was the cheapest bid by far. Those are the conditions that people see, that real Vermonters face every day. And so we have an aging housing stock that we need to look at maintaining. And everyone is dealing with these issues.
Do you have any sense as to the factors contributing to that cost increase? And do you see any sign of it abating this year?
I do see that there is more, we're getting more folks bidding. We just requested an RFP for architects, and 18 months ago, we would have had many architects tell us they were too backed up to even bid. We got 6 responses for a relatively small project. Likewise, we're getting a lot more contractors looking at us. It's interesting, we just went out to bid for construction management on an 18-unit, 5-building scattered site project. And we actually had one of the larger firms come in lowest because they want to keep their crews working. So unfortunately, what we're seeing is, even when we have something that normally would have been skewed to Northeast Kingdom contractors, the bigger firms got the bid because they just need to keep their crews busy. So I do see more of that. One of the biggest issues is just the cost of materials. You're looking at 50% labor, you're looking at 50% materials. We aren't seeing any reduction in material costs. Sometimes you might get a shift in materials through value engineering. Rural Edge has a standard specification, owner's standard specification. Because we're going to own things in perpetuity, our spec calls for cast iron tubs and ceramic tile. And I'll tell you, we've got 30-year-old buildings. We just redid the bathrooms, but the ones with cast iron tubs and ceramic tile, you might regrout a little, you might be caulking, but you aren't replacing everything. A fiberglass tub, you're going to be replacing. So that is our standard spec. And on Newport Crossing, we had value engineered, because we tried to fit from the cast iron tub and the ceramic tile down, only to have the construction management firm say, pricing has shifted. And actually, it's an increase either way, but it's going to be cheaper for you to get the cast iron tubs, and which is why we have to bring our construction firms on early on for construction management with our design teams, because everything is moving so quickly. And you really have to be able to respond and adapt. That has been our word. We adapt. So cost is a huge challenge. Cooperating.
You need to get out of it and back in.
Okay,
All right.
we're moving along. Exposure and risk. As we handle larger scale projects and developments that have things like brownfield remediation, historic preservation, and infill of downtown sites, they're more complex. The level of pre-development work is huge. The picture in the photo is the Sacred Heart site in Newport, which is 8.5 acres with multiple buildings that had been vacant, as I said, for more than a decade. But before we were able to take title to that, we had spent over $1.5 million in pre-development expenses that we weren't able to get reimbursement from any of the funding sources. That was a total of 3 separate pre-development loans and $500,000 of our organizational funds to advance that. So when you look at and you say, why are folks unable to build? That is a huge exposure. And then when I mentioned that we have 3 or 4 other developments, trying to move them all along, there are many nights when I don't sleep. This is the reality of what it takes to develop. Now, the upside is that site we now own. It was a brownfield site. The
A
brownfield,
lot of the 1.5 million, the brownfields.
maybe $400,000. We had to do over 100 test wells on the 8.5 acre site because there had been 2 underground storage tanks that the daughters, the nuns, had removed, and that was all documented with the state, but there was no documentation as to what had been done with the soil. Now, I have my suspicion that they told the janitor to spread it around the field, but we had to test all 8.5 acres, which are at just about the highest elevation in Newport. So, not a lot of groundwater at that elevation. So it was over 100 test wells that had to be drilled. So again, time and money, but lots of design work. Of course, we had to expand infrastructure. So we were bringing, and we did this as a planned unit development. So now that the infrastructure is in place, the city will take over ownership and maintenance, but we had to run all new. Thankfully, the city had ample capacity for both water and sewer, but had to run all new lines. They required 3 new fire hydrants, new roads, access roads for fire truck coverage around the building, even though the buildings were fully sprinkled. So lots of that is the design work and all of the engineering and architectural work and holding costs because the daughters were patient with us, but they were also savvy in requiring us to cover the maintenance of the site while we worked through it. But that just goes to show the amount of risk that developers have to be willing to take and stomach. There are infrastructure limitations. We frequently hear about water and septic. In this case, this is in Newport Center. You saw one of the new buildings. They have public water and sewer, but the existing buildings that were torn down had numerous fire and safety code violations, and they were constantly threatened with shutdown. But the town's water system doesn't have sufficient capacity or pressure for the sprinkler system. So we had to put a series of holding tanks and pumping stations in the building, even though we have public water and sewer. So not only do you have the expense of all of the tanks and that infrastructure, but the square footage required for that took up the amount of square footage that would have resulted in another 1-bedroom apartment. So if you think of not only do we have that added expense, we have the lost opportunity, which would have reduced the per unit cost. And this is what we see across the board in the developments that we bring online. A huge issue, which I'm sure you're hearing about, are lack of rental subsidies. We know that at the federal level, the outlook is not good. But while between 3,000 and 4,000 new units are needed in the Northeast Kingdom over the next decade, about 75% of those need to house folks making less than 50% of area median income. And so fair market rents are not affordable to this income bracket without rental assistance. To give you an idea of our portfolio, about 85% of our tenants, 3% of the Northeast Kingdom, receive rental subsidy either through project-based assistance or tenant-based assistance. And so, as we look to rehouse folks and we're creating net new units, some which have requirements to house folks moving from homelessness. And in one case, we have a letter, it's a contract, a letter of intent from the State Housing Authority to issue rental assistance for those homeless set-aside units. They've told us with a building that's nearly complete that they won't have the funds to honor that. So we have the obligation to house folks moving from homelessness, and we have not the rental assistance for those units. And we have folks who are currently living in hotels or in shelters who had expected to be able to move in, and we're working to look for a solution because we need to fill those units. And we have folks who desperately need them. To give you an idea of what some of our units with project-based rental assistance looks like, the lower left are the Lind homes in the metropolis of South Reigate, 7 worker homes. So each one is a 3-bedroom house. So we house many families with 5 kids in those, all have project-based rental assistance. And because we never do anything easily, 5 of them from rural development and 2 of them from HUD, all project-based. So we have separate regulations and requirements and separate waiting list requirements for 7 units. The middle building is on Summer Street in St. Johnsbury, has rural development and rental assistance. And in the lower right is Passumpsic View, which is 25 units of elder housing on Railroad Street in St. Johnsbury that has HUD rental assistance for 24 of the units.
Patrick, we are going to have another witness in about 5 minutes.
Okay, so speed. Construction trades, we don't have enough people to work. As a result, folks are bringing in crews from further away. That travel time, that lodging time is all factored into costs. Some of the systems that we have are really, really specialized. There are not local firms available, so lots of travel time, especially when systems break down, when they're placed in service and you need to provide heat in the middle of the night, and someone's got to come from Burlington or further away. But we are seeing more bidders, which is a good sign. But we have also had the incident in our Newport development because we have subcontractors from out-of-state firms. We had 5 visits from ICE. 5 visits for crews that were working incredibly hard. 10 were detained the first time. All were rightfully here and able to work. Working hard, buying eggs from the next door neighbor, playing basketball on their breaks with kids, and building these buildings so quickly. They were visited 4 other times, and now the construction management firm is having a full audit from ICE. So all of the cost, the delay, which is just something that you didn't anticipate. On top of everything else. Elevators, I don't think anyone has more elevators than Rural Edge in the Northeast Kingdom. The number of elevator companies nationwide is decreasing. And so the first thing you do, if you've got an elevator in your building, that is the first thing you're going to be ordering. Because the turnaround time might be a year. And because not only does the elevator have to be made, they have their own crews who may come from halfway across the country to install it. Likewise, firms, there are a limited number of firms for service contracts, and they are exclusive. And they get to you when they get to you. So it has not been, I mean, you may have seen across the state, there have been buildings that have been waiting on parts for a month or 2 months. I will tell you, I have staff who, when we have elderly buildings shut down, we're doing laundry, we're going to the grocery store, we're walking pets, the fire departments are on call. And, you know, we just had one instance where, to diagnose that on a holiday weekend, the repair bill was $1,400 an hour was the labor rate. And they identified a part that was over $11,000 that they would not order until they had payment in full. This is for 14 units of elderly housing. So when you look at the impact that this has on operating and on the folks we serve, it's a huge challenge. Likewise, on the inspection side, which is a requirement, the firm that does elevator inspections, the primary firm, was sold to an out-of-state company which didn't have insurance to work in the state. So if you had sort of an inspection in the last, oh God, Preston's looking at me, the last 4 or 5 months, you've been on a list, but they haven't been able to inspect. So there are a bunch of outdated inspections, not just in our buildings, you know, check the elevator certificates in this building, that are in the queue for inspections. So we have service contracts. They're inspected every month for our buildings, but they don't have the certificates. So this, again, is a real challenge. And then finally, operating realities, historic buildings and exterior paint, you know, $50,000 on a 3-unit building. And so, you know, we have requirements for historic buildings to inspect, to notify. There aren't enough certified, lead certified painters. Our full maintenance staff is both certified, and we have a certified supervisor, but it is a real challenge. And oftentimes, if you don't have those done, your tenants may lose their rental subsidy. So there's no window. One thing we've recently negotiated is wrapping areas in Tyvek. So we have lifts to wrap in Tyvek, because guess what? You can't paint in January exteriors of buildings. You know,
I guess, could you wrap up?
Yeah, this is my last one. Safety is huge. And while tenant rights are vital, the realities of landlords, and I know this committee is working on lots of laws, we've got to really consider the safety of all the tenants and expediting emergency evictions where there is clear and documented threats to the safety and well-being of buildings and residents is a priority, and one that we deal with every day. So what do we need? Consistent funding. Because we make the investment for the long term. We've built programs, we've got a pipeline, so VHCB funding is so imperative to our pipeline, both in rental and home ownership, which I haven't touched on. VHIP is great in sort of creating the next generation of responsible mom and pop landlords. But again, I would talk about the difference between VHIP not having permanent restrictions and permanent restrictions, mechanisms to help increase home ownership. So there are so many single family homes that we say, oh, if there could just be the generational change, young families could buy houses. But these houses have extensive renovation needs, oftentimes which limit mortgage programs. And while there are home repair programs, they don't really address the significant renovations. And so
Patrick, I'm gonna have to ask you
Okay.
to terminate it.
Well, this is the last one. So on a bright spot, continued focus on new solutions. Everyone working together to look creatively at solutions. How do we produce more, faster, but ensure high quality? Because that is what we are here for. And I thank you for the opportunity and would be happy to take any questions.
Thank you. You're going to share those with us, right?
Yes.
Thank you.
Thank you so much, Patrick. Really appreciate your testimony. Our next witness is Lorelei Tester, who has been here once before, who's the Executive Director of the Northeast Kingdom Chamber of Commerce.
Thank you for having me back.
Yes.
I'm not quite sure how, I don't know that I actually need the screen. I think that in some ways, you all heard what I said. It's an honor to be here. I'm Lorelei Tester, the Director of the Northeast Kingdom Chamber of Commerce, based out of Linden, but we represent about 50 towns of those 3 counties, Orleans, Essex, and Caledonia. It's been a really interesting experience for me to be in the chamber, and I jumped right in. It was kind of a little bit of the tail end of the last time that I had the opportunity to speak with you. But understanding the bigger picture of the economy of our rural areas, which also impact the entirety of the state, I think is so important for us to just have that global picture. And sometimes, I think it takes a minute to step back and we all get really focused on our sector or our pet project. And being in the chamber, I'm dealing with everybody, nonprofits, for-profit, small, large, individual. And I think it's beginning to really make very clear a story. I also am on the board of Let's Build Homes, which has been a real education for me. And there's a lot of value, I think, to the attention that is bringing to our state about the need for housing. And I think you've all heard it probably more than you care to, right? I don't need to paint that picture again. But what I'm realizing, especially as I'm one of the very few rural voices in that organization and in others, right? I feel like I'm often one of the very few who's willing to make the trek over to Burlington for some of these meetings, is so much of the well-meaning policies and things that we are implementing in these incredible programs are still they're not quite hitting the nail on the head for rural Vermont. And it is a bigger picture than just housing. And I have really been thinking even beyond, right? Like what happens when we hit the 30,000 mark in the next 5 years for this state? What happens then? And I think that I just chatted with a woman 2 days ago who lives in Westfield, and she's a new chamber member, and she said, but I think we're going to move to Tennessee. And this was on the very same day that I received a $30,000 check from the state of Vermont, biggest check I think I've ever gotten. It was for the GROW grant. And the GROW grant is for relocation and outreach for bringing people to the state, because we know we need better demographics. And I asked this woman, Wendy, why Tennessee? And she's like, I just can't afford it here. And Tennessee is kind of similar without the snow, right? Where they're looking for. And she said that the taxes are killing her. And I think that needs to be part of our conversation. I came here thinking, okay, I'm going to talk about housing. And that's what some of the slides were that I sent, because after my conversation and my testimony a week ago, there's a lot of ideas, right? There's a lot of ideas for how we do that, but we need to take that bigger picture of how are we investing our money and our time, and understand that bigger picture is so important. How does somebody who has lived here for, I don't even know how long Wendy's been here, she could be multi-generation, she could not be, but she's leaving. She's, probably about my age, and she's leaving to have her business elsewhere because Vermont is making it so difficult. So yes, we need to sort out our housing, and we need to make it easier for rural areas to succeed. But if we don't sort that out, it's all for nothing. And I'm feeling a little bit right now. It feels like it's a lot of
Is she
for nothing.
talking about taxes on her? She's talking about her business, or she's talking about herself, like property tax?
All of it. It's just the whole picture. And I think it's death by a million paper cuts. whether it's, in our, the work that we're doing, it depends on who you are, right? But Bud Stevens, a developer in Lindenville, he said that before they even broke ground, they spent $350,000 just in permitting before they could even get started. I have a great anecdote of a gentleman who runs Kirby Mulch. It took 3 years, $67,000 and 6 consultants to just jump through all the hoops and paperwork and all of it so that he could just start a business. Most people can't afford that. And I think that was a piece that I brought up a week and a half ago, is that our small developers just can't shoulder that. When you're looking, again, I mentioned Market Street, those developers are so big and they can handle it. They can wait because they're working on other projects. But the developers in our rural regions can't. They can't wait 3 years. They can't shoulder the $350,000. And so nothing happens. So apropos to the conversation today, I actually hosted a small dinner at my house last night with some leaders in our community to say, all right, what do we need to do with this housing thing? And it was really interesting. There were 2 developers there. There were 2 large employer CEOs, and there were a couple banking institution voices. The need is there, the desire is there, the ideas are there, the locations are there, and we're still not able to make it happen. And so we just being able to identify what are the hurdles that are preventing this success, because I think we all know that that's what we need. I don't, aside from some people who they want to keep their pristine, I don't even know what they want because it's not working out so well for us, right? The idea of NIMBYism. I would love to have a conversation with somebody who's going to these appeals and fighting the idea of development at this point. It feels very hypocritical in a lot of ways. So I have some, there's some ideas, that from some of those developers or things that would just make it easy. I think we have regulations that are killing the process of growth. And we also have some amazing programs, but it's not quite scratching the itch in rural Vermont. And I totally respect and am so appreciative of the work of organizations like Rural Edge and that demographic that we are supporting. But I just listed some testimony from Weidman, which is one of our largest employers in the Northeast Kingdom. They are doing a $40 million expansion and investment in our region. In the last 6 months, they've hired 100 people and they need to hire 60 more. Their head of HR travels an hour to get to work because she cannot find housing in our area. And this is an organization a company that they add so much to the economic strength of our state. And how are we going to support that level of growth? The consequences are great. So I came to follow up on something I started. I'd be curious what questions you have for me about what that really looks like on the ground, or I could keep telling stories all day.
Did you get more specific comments at your dinner party in terms of what pieces of did you get more specifics from the developers or from
one of the ideas moving forward is how do we aggregate all of the need? Because when you're dealing with something, so David Kaplan, who is actually going to be here at the State House tomorrow, he's also a CRNA and he's representing healthcare tomorrow, but he's also a developer. He has a plan for a 49 unit apartment building. And what the conversation really sounds like is if you're dealing with anything under 150, you can't get the finances to work. And as far as details, and so the conversation's all right, how do we come up with all of the projects in the whole region and begin to pull it together so that we can just economy of scale? And so that's going to require people beginning to work together. And I'm thinking it might be an extra project for me at the chamber to begin to gather all that data, because there are some real central points in Newport and Hardwick, Lindenville and St. Johnsbury where there's opportunity, but each of our individual developers are not coming up with projects that are large enough to make the finances work.
Yes, go ahead.
Is that 49 units with, it has infrastructure already?
No, it would be starting from scratch. It was a site, it was the Lincoln Inn, was a motel, that was right there. And they actually have plans scoped out for something more significant, as more of just a place to draw, I think similar to the Cambium or
Cambrian, right?
Yes, Cambrian Rise, but on, St. Johnsbury scale.
Did he mention how much 49 units in that area would wind up costing?
He might have. I apologize. I don't
When you were
know.
having a dinner?
I was having a dinner party. We didn't go into the granularity of that, but I could certainly find it out.
I'd like to.
Yeah.
Thanks.
Yes, I'm looking at the slides that you brought in
Mhm.
last time. One of the things, a lot of it reinforces conversations we're having elsewhere, and that's very valuable. There's one idea here that I wonder if you can unpack a little bit. It's rural housing rehab and conversion acceleration. You mentioned the streamlined code compliance for rehabbing buildings, upper stories, barns, schools, commercial buildings. The life safety focused and not new build standards. Is this something, so?
Well, the idea really is stemming from the town of Lunenburg, which has just under 1,000 homes on their tax records, and nearly a third of them are uninhabited or uninhabitable. And so, you think about what that does to a community and what that looks like, what the result of that. And so, there's still so many hoops that end up needing to be jumped through, but imagine being able to rehab that in a little bit of a better way and take away some of the, like, a house is meant to go here. How can we streamline that process to make it easier?
Okay. Are we finding they have to choose between doing a large project to rehab these buildings where a lesser amount of work would make it habitable? Are they having to choose between doing a massive project and nothing?
Well, that's a great question. I think that one of the pieces that we're beginning to ask the question of is just because we have so many issues with labor, and being able to make some of those things happen, is how do you reduce the cost per square foot? And that's shifting the conversation. I'm not quite sure what you're asking.
Well, I'm trying to, I've had conversations with contractors on the local level.
Mhm.
About, MHIP, and the fact that a sizable amount of those funds gets used for code compliance.
Mhm.
That might not ordinarily be required if it wasn't MHIP, okay? So wanting to take the dollar as far as we can, is there, say we're rehabbing an old school.
Mhm.
Are there, I'm trying to isolate where the regulatory roadblocks are between rehabbing it to be life safety focused, as opposed to having to take an old building and rehab it to new build standards, which is very different.
Right.
So am I following?
I think
your
so.
train of thought
Yeah,
to some degree? Am I-
to some degree. I mean, I think that it is that there are lots of I think that one of our solutions is that it's making all of these plans work, and in certain pieces, and I might be in a little out of my depth, I will confess. Yeah. As far as all of the nitty gritty, and I know that there are people who are smarter than me in those areas to put it all together. So this is a little bit more of a broad, okay, there are so many different avenues that we can and should be taking, but how do we make it possible? How do we make the Newport thoughts of a TIF district work out? And what are the things that are holding us back from making that happen? If we are taking some of these homes and just really identifying where's the rub, so that you don't necessarily, I think the conversation, I chatted with a man 2 days ago up in Newport who has, I think 300 units in the region, that he has accessed funding through with the VHIP program, and the requirements. And again, this is where details, I might not know all of them, so I apologize. That working with some of those restrictions he has done for 5 years and for 10 years and has received money to make that happen. And then in this most recent project that he's working on, he's like, I don't even want to be bothered, so he is now successful enough that he can make that decision. But why is it that we're making, what are those restrictions that are making those development opportunities so difficult? Yeah, okay, so I'll get in, I'll try to find a little bit more details of why from him.
Other questions? I've got, I guess, a very obviously difficult question, which you may answer by saying, I have no idea. One of the contradictions we face is we're hearing on the one hand that our taxes are too high.
Mhm.
On the other hand, we're hearing the complaint that state government is hollowed out and can't respond. So for example, we just had testimony that people can't get, they can't get inspectors to come out and inspect elevators. They can't get any response from the state on the homeless. And if you talk to state employees, they'll tell you that they're, have too few people trying to do too much. So how do we resolve that contradiction? There are those who argue that it's just an artifact of being a state that's too small and that there's nothing to be done about it. And I'm wondering if you, looking at the big picture, have any thoughts?
I do. I think that we are in some ways we want our cake and eat it too. I think in so many different pieces of our lives. I think about healthcare and the expectations that we have placed on, like we want God, right? We want somebody who doesn't make a mistake, where our outcome is exactly what we want it to be. We want to be able to take a pill and have it all be easy. And that's not reality, right? And it's also really expensive when we create that. And we have created systems now that are so complex that we cannot be successful. And so the problem now is that because we don't have enough people, our healthcare costs are extraordinary. And because we don't have a balance in our system, I 100% believe that everyone deserves to have their needs met. I grew up in a log cabin in Newark, and we didn't have plumbing or electricity, and it was not a lifestyle choice. Let's just put it that way. It's important to have safety nets, but we also need to provide balance for our communities. And the reality is, if we're only serving the safety nets and we're not creating a balance, the numbers just don't work, right? And so there's somebody like me. I mean, I'm on 6 boards. I work way more hours than I'm ever paid for, and I'm not paid well, right? But that's okay. I love it. I love what I'm doing. I feel like I'm participating, but most people don't necessarily have that deep love of, everyone in this room does, but that's not enough to run our society. And so, oh, you got me going. I think that our systems are so complex. The expectations that we have are so complex, and we want perfect outcomes every time, and that's not sustainable. So we need to figure out those places where we can make it easier. We want so badly to regulate everything that it makes it hard. And so, especially on the east side of the 91 corridor, it's just as easy it's way easier to go to New Hampshire than it is for me to come here to Montpelier. Developers aren't interested in dealing with St. Johnsbury. People, I actually chatted with a woman who was in a economic development organization who was planning a move to New Hampshire because is more affordable, and she could send her child to St. Johnsbury Academy. So we need to have a really, really good look at why is someone who works for an economic development organization in Vermont making that choice. There are reasons, and I think we all could we could probably type it into ChatGPT and say, why might someone do this? What are the policies that we have in place? and what is it that we're really trying to do? But we need to broaden our workforce. We need to broaden our tax base, or all of these things are never gonna work, and we're never gonna get somebody to come and inspect our elevators. Because it's just too hard to live here.
Thank you. Any questions? Laura Lee, thank you for coming.
Thank
Much
you.
appreciated. We are at the end of this section, the Northeast Kingdom hearings today. We're going to, do next is we have one bill to take up. And we're scheduled on our agenda for a vote. But, and are we gonna have council 11:45?
Thank you so much.
Thank you.
Thank you.
Perhaps you take a break. She'll be here at 11:45. So what we'll do is we'll take a break. And at 11:45, we'll come back here. And the assumption is that with H 532, which is an act, remember, relating to mandatory retirement of college professors, in which happened to violate federal law and therefore was simply ineffective. But in order to make that clear, this bill just aligns itself with federal law that's been that way for a long time. It has been our assumption that since this is merely a technical correction, that we don't need to take testimony. But I would like our counsel to be here, and then we'll vote on it. And whatever the vote is, the vote will be. All right, So-
see you at 11:45.
11:45. Thank you very much, everybody, for coming to this.